liver transplants, lung transplants, kidney transplants, face transplants, heart transplants. But a head transplant? Would you ever think of the day that we would have a head transplant being performed? Well, coming up at the end of this year, these two surgeons are going to do the first procedure of a head transplant. On the left is Ping Ren, who is from Harbin Medical University in China. And on the right is neuroscientist Sergio Canavero. These two together are planning to perform the first head transplant ever. This man is Valery Spiridonov, and he is a Russian man who was the first volunteer for the head transplant. He suffers from Werdnig-Hoffmann disease, which is a fatal genetic disorder that affects the brain and damages tissue in the spinal cord. He worked with Surgeon Sergio for almost 2 years, but earlier this year it was decided that he would no longer be a candidate for the head surgery, and this is for unknown reasons. They've had to come up with new plans for the surgery. The surgery will now take place at the end of this year in early 2018. The surgery will take place in China by an unselected Chinese national. The surgery will take up to 72 hours and will use 80 surgeons to complete the surgery. Surgeons Ping Ren and Sergio Canavero believe that they will have a 90% success rate. They have already had a selection of candidates to receive the procedure. According to CBS News, the body will need to be cooled down to 50 degrees Fahrenheit to prevent damaged tissue in the brain. Both heads will be completely decapitated by severing the spinal cords at the same time. A custom crane is going to be built to be able to transfer the head of the recipient to the donor body. The spinal cord will be fused together by a gel called polyethylene, and the muscles and blood supply will be joined to the head. The patient will need to be kept in a coma for 3 to 4 weeks to give time for healing. Implanted electrodes will be used to stimulate the spinal cord and to strengthen the nerve connection. There have been a lot of critical feedback from other scientists around the world. Arthur Kaplan, who is the head of the medical ethics at New York University at Langone Medical Center, states that it is both rotten scientifically and lousy ethically. Dr. Jerry Silver, a neuroscientist at Case Western Reserve, who worked on repairing spinal cord injuries all his life, said it is bad science and this should never happen. So what do you think? How would you feel if your loved one's body was being walked around on this earth with another head on it? I know we appreciate a lot of donors in the world who have needed to receive liver transplants and lung transplants, but is it different when it's a head transplant?